Good afternoon, everyone. Welcome to BC Transplants Ask Me Anything on organ donation in BC. Thanks to everyone who is joining us today. I am Tina Robinson. I'm the Manager of Communications and Community Relations with BC Transplant, and I'll be hosting the webinar today. I know that many of you are joining from other parts of the province, but I'd just like to first acknowledge that we're coming to you from Metro Vancouver, which is in the traditional and unceded territories of the Squamish, Tsleil-Waututh, and Musqueam nations. As we get started, I'm just going to go over a couple of items so you know how to participate. You've joined the presentation by default with audio and video muted. Those of you joining on the computer can submit text questions to our panelists by typing them into the questions pane found in the Zoom toolbar at the bottom of the meeting window. And we have turned off the chat function just to make it easier for us to monitor the questions panel. We have also received a few questions in advance as people registered and as well through our Facebook channel. So we'll come back to those questions a little bit later as well. Today's webinar is being broadcast on Facebook Live, and we will make it available online afterwards, both through our Facebook page and on our YouTube channel. Before we get to questions, we are going to start with an overview of the organ donation process from start to finish here in BC. And we're lucky enough to have a couple of the members of our organ donation team joining us today to give that overview. We have Bobby Paquette and Kim Savory. Again, they're both members of the organ donation team, and they'll be doing probably about a 25-minute presentation total. And then we'll get to all the questions that they don't answer in their presentation and whatever comes up for those of you joining us today. Before I turn it over to them, we thought we'd just show you this video that gives an overview of the process of organ donation and the hundreds of people who are involved in various parts of the process, starting with the organ donors whose generous gifts of life start the whole process. I hope you guys enjoyed that video as much as we enjoyed making it. There's so many people involved in donation and transplant. And of course, we thank all of the people who are involved in that process. I'm going to hand it over now to Bobby Paquette, who is a member of our organ donation team, and she'll get us started. Over to you, Bobby.
Thanks, Tina. So I'm just gonna start off with BC Transplant. Who are we? So we oversee all aspects of organ donation and transplant across BC and manage the organ donor registry. We work with all the regional health authorities and collaborate with our provincial partners to make donation happen so that we can have hundreds of British Columbians get life-saving transplants every year. So part of our mission is that with compassion, collaboration, and innovation, we will save lives and create hope through organ donation, transplantation, and research. And part of our mandate is to increase organ donation, reduce the number of patients on the transplant waiting list, and improve how we deliver care to transplant patients and donor families. Because without our donor families, we would never be able to do the work that we do. So organ and tissue recovery in British Columbia. BC Transplant looks after solid organ donation. So we do heart, lungs, liver, pancreas, islet cells from pancreas, and kidneys. We work very closely and collaborate with the Eye Bank of British Columbia, who recovers corneas and sclera. So our team is made up of healthcare workers who either worked in ICU, in the OR, or in the emergency rooms. Our team is made up of compassionate individuals, and we all thrive to make a difference in people's lives. So we have organ donation specialists. These are coordinators who take referrals from the hospital, coordinate everything for organ donation, help the ICU manage the patient, book ORs and logistics, planes and paramedics and surgeons and nurses so that these transplants can happen. Then we hand it over to our surgical recovery specialists. So these are coordinators who coordinate the whole recovery. They are in contact with, they're in the donor OR coordinating with the recipient OR. They're on the phone so that communication can happen. We also have in-hospital coordinators. These coordinators support and educate all the hospitals and all the regional health authorities. And then we also have our organ recovery assistants who help our surgical recovery specialists do the recovery of the donor and make it all happen. There are two types of organ donation in BC. We have living kidney donation. So this is where we have two kidneys, so they can donate one of their kidneys directly to a family member or a friend. We also have living donor paired exchange. So that's if I wasn't a match for my family member, but I was a match for somebody else's and they were a match for mine, we do a paired exchange. And we've done up to 6 here in BC. We also have anonymous living donors, so to anonymously donate your kidney. The other type of donation is deceased donation, which will be our focus today. And most organs come from deceased donation. So to donate organs after death, a person needs to die in hospital in a specific circumstance. Often this is after an accident or a brain injury. And this is only 1 to 2% of people who die in hospital in this way that would allow them to donate. We are 4 to 5 times more likely to need an organ than to be able to donate one. And there's no telling how long you would wait for this organ. In fact, some don't receive this life-saving organ because the waiting list is long and there aren't enough donors. So what does the process of organ donation actually look like? We have a piece of legislation that just states A facility must notify, so a hospital must notify the agency, so BC Transplant, in the event of death or impending death of a patient 75 years of age or younger. So these are patients who are ventilated either in emergency or ICU, who nothing can be done for them. So our in-hospital coordinators educate hospitals so that they refer these patients in so that we can see if they're eligible, and we can look up their registration, see what their wishes are, so that when the hospital is talking to these families about end of life, withdrawing from life support, they can let them know whether A, they're eligible to be a donor, and B, whether their loved one has registered their wish to be a donor or not to be a donor. So the process starts with the hospital identifying these donors, calling it into BC Transplant, where we have a coordinator on 24 hours a day, 7 days a week, to help take these referrals and help the hospital manage these patients. We meet with families either in hospital or over the phone to discuss what the process looks like, so that they can decide whether this is right for their family and if this is what their loved one would have wanted. We support ICU staff, so help them manage these donors, what testing we require, so that we can find out what organs are viable for transplant. Then we start the allocation and organ offering process. And this is the phone call that everybody on the waiting list has been waiting for, to receive their life-saving organ and a second chance. After we've decided which organs are viable for transplant and we have recipients lined up, then we set up a time to withdraw life support or go to the OR. We then hand it over to our surgical recovery specialist, who will coordinate the recovery process in the OR. They coordinate this process, and organs are sent to our transplant centers, where recipients and transplant teams are waiting to do these life-saving surgeries. So who can be a donor? Donors must be on a ventilator, they're in ICU usually, or they're in emergency. And doctors have done everything they can, and there's nothing more that can be done. And the decision's been made with the physician and the family that the plan is to withdraw care and to move towards comfort care. So take them off the ventilator, make them comfortable so that they can pass. But before they do that, the call is made to BC Transplant to see if they're eligible to be a donor, that nothing would preclude them from being able to be an organ donor, and also to look up their registry. And once we look up their registry, if they've registered, whether it's yes or no, we send that to the ICU or the emergency, so that when they're having these conversations about withdrawing from the ventilator, they have this portion to kind of help them make the decision that their loved one would have wanted. So there are two pathways for organ donation. The first one is neurological determination of death. So these are our brain dead patients. They have an irreversible loss of function of the brain and brain stem. They have no more blood flow to the brain. All their brainstem reflexes are gone. They would no longer breathe on their own. They're on a ventilator that's keeping them breathing and keeping them alive. These patients are able to donate their heart, lungs, liver, pancreas whole or islet cells from the pancreas, kidneys, and eyes. And so when the physicians do their brain death testing and determine somebody's brain dead, this is the equivalent of a death of an individual. So even though they're on the monitor, their heart is still beating, they feel warm, this is equivalent to a death. The second pathway is donation after cardiocirculatory death. So these are patients who don't meet brain death criteria. They either have some flow to the brain and they just don't meet this criteria, but everything's been done to try to save this patient and nothing else can be done. And the family and doctor have decided that the best course of action now would be to remove them from the life support to let them pass. But before they do that, they would call us to send in the referral, and we would do the workup of this patient, which takes some time. And then once we've decided, what organs are viable for transplant, we take them off the life support to let them pass, and then they go on to the OR. And with these donors, because we're waiting for their heart to stop, they're only able to donate liver, lungs, kidney, the islet cells in the pancreas, and their eyes. And BC Transplant is not involved at all in the decision to withdraw life-sustaining therapy or to move towards comfort care. It's only after the physician and the family have discussed and decided this that the call is made to BC Transplant.
I'm going to take over now from Bobby. Thank you, Bobby. So once that decision has been made and BC Transplant has been contacted by the hospital, we send in an organ donation specialist who is trained to meet with families so that they can explain the process of organ donation as an option now that the person has reached end of life. We explain the process fully from beginning to end and allow the family to ask any and all questions they may have. And then the family can make a decision if this is what they would like to move forward with for their loved one to donate their organs. This also involves them seeing the organ donor registry to help them understand what their loved one's wishes were if they had registered. And if not, then we have the family think about what they think their loved one would have wanted so they can make the choice for their loved one's best interest. Once they decide, or if they do decide that they want to move forward, the organ donation specialist will complete a formal consent form with the family. And we also go through a medical social questionnaire with the family to gather as much information about the patient as we can to determine which organs they'll be able to hopefully transplant into someone else that's functioning well enough. It's very important that everyone know that we are there to support the family's decision, regardless of what it is, whether they decide to consent to donation or not. We fully respect the family's decision. We just want them to have all of the information and make a decision as one of the options available to them at that time. We've spoken with many families who have their loved ones who've donated in the past, and they feel very much that it brought them a sense of comfort at a time of loss. It's a very difficult time for them, but down the road, it does provide some comfort that something good was able to come out of the tragedy. Often hospital staff feel uncomfortable asking a family if they're interested in organ donation because they feel like the family is in such a tragic time and facing such a difficult situation already. But what we've learned from donor families is that it's important that we ask them and let them make that decision for themselves, because if we don't even ask them, the decision has already been made for them, and we want to give the family the decision that's what's best for them. Once a family has consented to the process, we will manage the donor during this time period. So because their brain has died or has been severely injured, the mechanical ventilation is what is keeping the body alive. The process from the time the hospital calls BC Transplant with a potential referral until we take the patient to the operating room to recover the organs is about 24 to 72 hours. And during that time, BC Transplant works with the ICU hospital staff to maintain the patient. Sometimes it means giving them medication to keep their organs going or to even improve the function of the organ. It won't help the person, but it will help the organs for the recipient that's going to receive them, and make sure that we can maintain their body until it's time to go to the operating room. That time period, what we're doing during that time period is evaluating the organs to see which ones are safe and functioning well enough to be able to save someone's life. So we're checking the patient for any signs of infection or sepsis of the organs. We're making sure that there's no disease or trauma to an organ depending on what the cause of death was. Unfortunately, cancer is something that can be passed to a recipient, and so we can't take organs from someone who does have metastatic cancer because it could be passed to the recipient. So that's something we're checking in the patient to make sure there is no signs of cancer. It's also really important that we understand what the cause of death was, because if we don't know what caused the person to die, we don't want to pass that risk on to the recipient. And then we also need to make sure that we do have matching recipients. And this could be based on the donor age, things like that, that could potentially rule them out. We have no set hard age rule cutoffs, but as a patient gets older, generally over the age of 80, usually their organs are not usable. That doesn't mean we won't investigate to see if they are able to be transplanted or not. Then we also need to do the testing to determine the organs that are good, because just because someone's able to donate their organs, it doesn't mean that they're able to donate all of them. So we need to check each organ and see which ones are working well enough. So first is that medical social questionnaire that I talked about. And this is a questionnaire we review with the family to gather as much information as we can about the patient, about their health. So any health history they already had. It goes into their lifestyle, their travel history, where they were born, even into behavioral things like alcohol, drugs, and sexual history. And the importance of that is to know that the organ is safe to be transplanted into a recipient without giving them greater risk. We also do blood work that lets us check for any infectious diseases. It also allows us to match the donor's blood to the recipient blood to prevent any rejection. For each individual organ, we do separate testing. So for the heart, we do ECGs, echocardiograms, and angios, which give us a picture of how the heart is functioning. For the lungs, we do O2 challenges, which tell us how much oxygen the lungs are able to utilize. We do chest x-rays and CT scans to give us an image of how the lungs look that would also show up if there was any disease. And then we do a bronchoscopy, which is where we look down the breathing tube to look at the inside of the lungs. For the abdominal organs, which include liver, kidneys, and pancreas, we also do a CT scan for imaging. And then depending on the patient's history, we may also do an ultrasound that can give us a better image of the organ as well. Once we know which organs are functioning well enough and safe enough to be transplanted, then it's about matching it to the best recipient that will have the best outcome from receiving that organ. The match is done first by blood type. Then we also need to match by size. You can't put a 6'2" person's lungs into a 5' person. They simply won't fit. Same with the liver. So it's important that the organ will fit into the recipient. Then we look at who is most medically urgent and in need of that organ. And then it's also who's been on the wait list the longest. We only ever recover organs if we have a recipient lined up for them. Out of respect for the donor, we don't take organs that we don't plan to transplant. We try to keep BC donors' organs in BC. The exception to this is for what we call high status recipients. And high status recipients are someone who is so sick, they're going to pass away in a very short time period, 24 to 48 hours, if they don't receive an organ. When they get that sick, they go on an alert to the entire country. So every organization like BC Transplant across the country is looking for an organ for that specific patient. So if our donor is a match to a high status anywhere in the country, we will offer to them first to make sure that sickest person gets transplanted. There are also highly sensitized recipients, which means they have a lot of antibodies in their blood and they don't match any donor. So if the donor we're working on is a match to a highly sensitized recipient, we will try to make sure the organ goes to that person because it may be the only time they will ever have a donor that matches them. So if there's no high status or highly sensitized patient recipients, then we offer to the BC recipients based on who's most sick and then who's been on the wait list the longest. If there are no matching recips in BC, then we offer across the country, starting closest to farthest, so offering to Alberta and then working our way across the country, because the shorter the time the organ is out of the body, the better it will do for the recipient. And then lastly, we have a reciprocal sharing program with the US, so that if we can't find a suitable recipient in Canada, we will offer to the US, and likewise the US offers to us. This is quite common, especially we get a lot of offers from patients in Alaska simply because geographically they can't make them any further than the northwest of the US. So if they don't have a suitable recipient in that area, then they'll offer to BC and Alberta to make sure that the most possible people get transplanted that we can. There's a lot of juggling to try and find the best operating room time to actually take the patient to the operating room to recover the organs. First of all, we want to ensure that the organs are of the highest quality and maximize the number of organs that can be transplanted. So sometimes this means waiting a little longer before we go to the operating room because we can do additional medication and testing to improve the organ's function. Or it may be going to the operating room sooner because the function of the organ is going down and we need to recover it as quickly as possible. The donor's family needs is the most important thing to us, so we do our very best to facilitate the needs of the donor family. Sometimes a family has been in hospital with their loved one trying to get them better for quite a while, and then by the time we're called in and there's nothing else they can do, they've already been there for a long time. So we try our best to keep that time frame as short as possible. However, sometimes family have members coming from long distances away to say goodbye to their loved one, and so they ask us to wait a day before we recover the organs so that their loved one can see them in the ICU. So we work with the family for that. We also need to minimize the disruptions to the ICU and the OR. Operating rooms have scheduled surgeries, so we have to work within that to try and get a time to get into the operating room. And then we also have to facilitate the team, the surgeons, the planes, and of course the recipients getting to their transplant operating rooms so that they're there before we recover the OR. So there's a lot of juggling of the time to find the perfect time to recover the organs for the best outcome. So BC Transplant has a mobile recovery team made up of nurses, physicians, and the surgical recovery specialists who will travel to any hospital in the province where they can manage a ventilated patient. So if we have a patient anywhere in the province, then when we're going to go recover organs, then we will take all of our equipment and we will fly to that hospital to recover the organs and then fly them back to Vancouver for the transplant. We go to any hospital operating room, so they may or may not have the equipment we need. Smaller hospitals may not have everything, so that's why we bring everything we need for the safe transport of the organs back to Vancouver. So people often ask, how long can an organ be out of the body? So these time frames are what we call the maximum cold ischemic time. So how long an organ can go from not having blood flowing through it. So these times are from when the donor's heart stops beating and the blood stops flowing through the organ until the recipient's blood starts flowing through the organ. So during these time frames, we have to recover the organ, transport it, and transplant it. So heart and lungs are only about 4 to 6 hours. Liver is about 8 to 12 hours. Kidney is 8 to 24 hours. For all of these organs, the shorter the time, the better. So if we're looking at 8 to 24 hours on the kidney, we do have a special machine that we put the kidney on that will help keep it viable for a little bit longer. And then pancreases are 6 to 8 hours before they need to be transplanted. We utilize airline charters, Air Canada, ambulance services, courier services to make sure that the organs get back from the donor site to the transplant site as quickly as possible. So we have great teams in the province that work very closely with us and make themselves available to get those organs back as quickly as they can. So in BC, all the transplants are done in the Lower Mainland. So BC Children's does pediatric kidney transplants and pediatric heart transplants. Vancouver General Hospital does all the lungs, all the livers, and all the pancreas and islet cells that are done in the province. And St. Paul's does all the heart transplants. And then both VGH and St. Paul's can do kidney transplants. Once a recipient has received their organ and they're safe enough and stable enough to travel back to their home sites, then they can be monitored and followed up with the post-transplant centers. There are 8 of them throughout the province that they can be taken care of at. So this is just to give you an idea of all the great work that the donors, recipients, and BC Transplant and the hospitals have done last year, even despite it being a pandemic year. We were able to have a record number of referrals from hospitals. So those are calls from the hospital about potential donors. It doesn't mean they become a donor. It's just letting us know about them. There was also a record number of heart transplants done last year, 33, and 3 of those were to children. There was a record number of lung transplants done, 55, and we tied the record for liver transplants, even though there was a pandemic last year. And in BC, there are almost 5,500 people being looked after they've had a transplant. So that's an amazing effort by the healthcare program in BC. I'll pass it back to Tina now.
Thank you so much, Kim and Bobby. Really appreciate you sharing your knowledge and skill and the work that you guys do every day here in BC. I'm just going to change the view. We have received a few questions in our Q&A box, and so now please, anyone who's watching us, you're welcome to plop your questions into the Q&A. And like I said, we do have a few questions that we received beforehand, so I'm going to just get that going here. I'm going to pull those questions up. In the meantime, we did receive a question in the Q&A box here, Bobby and Kim, and maybe one of you could take that question. You mentioned that only 1% to 2% of people that die in hospital are eligible to donate. What percentage of that number actually donate any of their organs?
Do you want to answer, Kim, or do you want me to?
Sure, go ahead.
So 1% to 2% of patients are eligible. And so then we kind of look at the organ function, and depending on the injury or how the events that led them to this and their past medical history, we might be able to only take, a couple different organs. There might not be anything viable, but at least we explored that, especially if they registered their decision. Then we tried and explored to see if there was any potential there. So it's hard to give an exact number out of that 1% to 2%, how many go on to actually be donors, but we do explore all of them with our transplant programs to see if there's any eligibility.
I can add to that. So there was the 619 referrals. So those were the ones that were eligible to be called into us last year. And then of that, I believe we did 110 donors who were able to donate at least one organ. Many of those donated more than one organ, but they were able to donate at least one organ to count in that 110.
Great, thank you. So one of the questions that we received beforehand as people were registering, and I think actually probably this would be good for both of you to answer, but maybe Bobby, you can start. What do you wish the general public knew about the transplant process?
For me, it's always an honor to meet these families. They've experienced this great loss and they're still willing to talk about organ donation with me, to meet with me, talk about the process. So I always find that like an honor to meet with families, and just that we are very transparent with our donor families. There's a lot of trust involved in this process with their loved one. So as an organization, everybody we work with, we are very transparent with families about the process, what they can expect over the next day or two, and what it's all going to look like, so that when they're agreeing to organ donation, they know exactly what that actually entails.
And I think we actually just touched on it with the last question. The thing that most people don't know about organ donation is what a special gift it is, because so few people die in a way that they can donate. One of my colleagues used to call it the death lottery, that she said if she had to die, she hoped she died in the right way, that her organs could be used, because the person does have to be in hospital and on a ventilator in order to be able to donate their organs so it's just such a small pool of people, and so we're so grateful for the families that are willing to go through the process, and the people who register their wishes, so their families know that is what they'd like to do.
Great, thanks both for your answers on that. Another question that actually there's two questions and they're related. Maybe I'll give it to you, Kim, first. Just thinking about eligibility of donors. If you passed from cancer, is there any organ you can donate? And then actually start with that one first, and then I'll come back to the other question that's come in.
Sure. So unfortunately, cancer is something that if it's in the cells can be transferred to a recipient and is quite a risk to the recipients. So we do not take organs from someone who has active cancer or recent cancer. If it was a long time ago, then we run it by our medical director to have him assess the risk of the type of cancer the person had in the past and how it was treated. The exception to that is if someone has a primary brain tumor that has not metastasized anywhere else in their body, and they haven't had any type of surgery that would have exposed that tumor to their bloodstream that could be passed on. So a very small pool of people with cancer can donate organs. However, they can still donate their eyes. Most cancers, people with most cancers can donate their eyes, and a donation of eyes from one person can go to help repair the vision of up to 8 other people. So that's still a really, really important gift.
Wow, that's great. That's something I just learned too, Kim. I didn't realize that. That's really great. And then I guess, and this is related in some ways, if you're HIV positive, can you still donate your corneas? Because there's, I mean, is that sort of the same case as with cancers?
That's a little different. So because donation of eyes is a life-enhancing transplant as opposed to a life-saving, improving someone's vision is an amazing gift, but someone could live without their vision. There is no risk taken of someone with an infectious disease such as HIV. Currently, we aren't taking organs from someone who's HIV positive, but that doesn't rule them out that if we had a recipient who was HIV positive themselves, that they wouldn't explore the possibility of doing an HIV to HIV. We haven't done one yet, but it is a possibility if that were to happen sometime down the road.
Okay, thank you. So a question that's come in through Facebook. So why isn't my desire to donate listed in my medical records? And second question from the same person, I think my family will respect my wishes, but is there any way to make it so you don't even need to ask them?
Do you want to do that, Bobby?
Sure, or we both can. So to register your decision, you can go on to our website and register yes or no to your decision. I'm not sure why it's not part of your medical records, but that's a way you can. And then speak with your family about your wishes so that when the time comes and we are speaking to families, that they know what you would have wanted. I think, kind of what the public thinks organ donation is as opposed to what it really is very different, which is why it's important for us to speak with families and discuss with them so that they can make a decision for you based on actually what happens, because you have to stay on a ventilator for another 24 to 72 hours. And people who register their decision, they may not have known that, or they may not have known that we're going to start doing testing. We might look with a camera at your lungs, and that's something that they might not have wanted. So it's important to have that discussion with your family.
And I can add, yeah, I can add. So one of the main reasons we purposely made sure that your wishes aren't shown in your medical records, and it goes along with one of the other questions that I know Tina's going to ask because it was asked earlier, is if I go into the hospital and they know I'm an organ donor, will they not work on me as hard? And so that's why it's very important for us to be able to tell everybody that the physicians and the staff at the hospitals don't know who's a donor or not a donor until they've done everything they possibly can and exhausted all life-saving treatments. And then it's at that point that they call BC Transplant, and we're the ones that look up to see if the person is registered and what those wishes are. So that's actually purposely done that way to help people feel more comfortable about registering, because that was a concern that we had heard quite a bit. So that's why it's done that way.
Okay, thanks. Another question, there was a mention of different sites in BC for follow-up of transplant recipients. I've had my lung transplant for 1.5 years and have not been referred to one closer to me. Is that normal for lungs?
That's not a question I can answer. Tina might be able to
Right,
answer.
I can actually answer that. Yeah, so typically the post-transplant clinics provide post-transplant care for kidney recipients, just because I think it's a specialized level of care, or specific people who will be following you. So lung, heart, liver are all typically seen back at the transplant centers. So that's probably why you haven't been referred to one of the post-transplant clinics closer to home. Okay, I'm going to switch to one of the questions that we received beforehand. Just someone was asking about plans in BC for live liver donations. I know that we do live kidney donations quite frequently. Just wondering, maybe Kim, if you could answer that one about what the plans are for live liver donations here.
Yeah, absolutely. So we did do living liver donation in BC from 2001 to 2015. And then our deceased donor numbers increased so much that the wait list became quite short for liver recipients. Living liver donation is riskier for the donor. Kidney donation is quite safe because for living liver, they have to split the liver, which is an organ that bleeds quite a bit. It's more risky for the donor. So while we have had enough deceased donors and have not needed to risk living donors, we went away from it. However, we are going back to that. We had hoped to go back to doing living liver again in 2020. Of course, COVID prevented that. And so hopefully we will be able to restart doing living liver as well in 2022.
Thank you, Kim. Another question that we also received ahead of time was what screening and testing is done to a kidney state of health before being considered as a healthy, acceptable organ for transplant. This question applies to either living or deceased donor and does not refer to just the compatibility issues.
I can answer that. So when we meet with families, we do what's called a medical social questionnaire, and Kim had spoken about this, where we talk about their medical history, any infectious diseases they have, their social history, their sexual history. So we kind of get that information. And then we also do blood tests to look at the actual function of the organ, of the kidney. And usually our donors also go for a CT so we can look at the kidney. So those are kind of the tests we do to look at kidney function. And then for living donors, they also will go through a psychological assessment to make sure that, they understand what they're signing up for, that they're doing it on their own free will, and that they're not being coerced at all, that this is something that they understand the risks for, they understand everything they're signing up for. So with living, they'll have a psychological assessment as well.
Thanks so much, Bobby. So another question about what lifestyle or sexual history would discount a person from being a donor? Maybe Kim, do you want to take that one?
Sure, absolutely. So there are no lifestyle sorry, I can't remember what you said, anything like that that would discount or prevent a person from being a donor. What it is it lets us know the level of risk to the recipient, and then we are able to offer the organ to the recipient and the recipient's physician who understands it, to figure out whether that level of risk is something that is appropriate for the recipient. So if the person is doing fairly well and they can do longer without getting a transplant, they might wait for another organ. Or if they're very sick, then they will be offered the organ knowing the level of risk, and then they can make an informed decision about accepting that organ. But often a lot of the diseases such as hepatitis C, for example, we can now treat that. So we can transplant an organ with hepatitis C to a recipient without it, and we simply treat the recipient to prevent them from getting the disease, because the risk of dying from not having the transplant is much greater than from any type of disease process. So just to recap, it wouldn't rule them out from being a donor. It just allows us to know the level of risk so that it's an informed decision for the recipient and their physician who are making that decision for accepting the organ or not.
And correct me if I'm wrong, I mean, the recipient doesn't know anything about the donor. They just know there may be a slightly increased level of risk for whatever reason, and they don't know exactly what that might be, though. Is that correct?
That is correct. Yes, thank you. Yeah, that's true. So it's still anonymous. It's just enough for them to know what the risk level is to them, but not what it's caused from or anything like that.
Thanks. So another question that we've got through our Q&A function here is, if I'm an organ recipient, can I donate any of my organs?
Yeah, I can answer that one. So if you've had like a kidney transplant and something's happened and now you're in a situation where you're able to be an organ donor, you are able to donate your other organs like lungs, liver, heart. Usually we won't retransplant the organ that you've had transplanted because of the surgery, there's scar tissue, but we will assess that. We will offer the program and assess that. And if it is retransplanted, that's called a domino transplant. And here in BC, we have actually retransplanted a heart that was already transplanted because they had died of other circumstances.
Thanks, Bobby. So another question that we received actually in advance through Facebook, if we become donors, do we get to make recommendations about who receives the organ?
So no, you don't get to make recommendations. We have like a transplant algorithm process that we follow, and it goes to those who are in most need. So we don't get to pick and choose. We follow this algorithm and this process, and it goes to the one who's in most need, that's most appropriate. Great,
thanks. So here's a common question that we often get. I know that we hear this when we're out at community events in pre-COVID times, of course. But one of the common questions is, will they in the hospital try to save my life if I'm known to be a registered donor?
Yeah, so that's sort of going back to that reason about why no one can see if you're registered or not. We purposely, they don't know until they've exhausted all life-saving treatment they possibly can, and then they contact BC Transplant, and we're the ones that can look it up to see whether you were registered and what you're registered for. Just so you know, you can register to be an organ donor. You can register if you don't want to be an organ donor. You can also let us know what organs you would like to donate, because just because you're registering to be a donor doesn't mean that you have to donate all of your organs. You can specify. And so that's the reason no one can see that until they call us.
Thank you. Okay, Kim and Bobby, this is for both of you. So what's your suggestions for when you're approaching a family and they say it's against their religion? So for example, the example they put here is Jehovah's Witnesses who, can we guarantee no blood will be shared through organ donation? So I guess that's a very specific question on that, but what about if someone who does, could be another religion who says it's against their religion? How do you approach that situation?
I can start. For me, I just want it presented to the family. I just want to give them the option, and it's really individual why they decide yes or no to pursue organ donation. We just want it offered. What else, Kim? What do you want to add to that?
So, I mean, if they feel it's against their religion, that's completely what they feel. If they have questions, they can speak to their whoever is the higher up in their religion to ask if they're unsure. There was a study many years ago where someone did speak to all the major heads of all the religions, and pretty much all of them said that they either believe in donation or it's the person's choice, that the actual religion doesn't have a specific stance on it. But again, we honor the family's wishes, whatever they are, and simply if they have a question, we would direct them to their leader of their religion. And if they say that they believe it's against the religion and they don't want to do it, we respect that as well.
Yeah, like families are losing their loved one, and like if they're deciding that that's not what their loved one would have wanted, then we want to respect that. We just want them to have that, be able to make that decision.
Okay, question for you about maybe Kim, when you say that BC residents are prioritized for organs, does that include patients from the Yukon?
Yes, so we do get referrals from the Yukon as well. And in terms of recipients, if they are followed by a BC program in the Yukon, then when we offer the organs, they would fall under that same program if that's where their transplant program is. So when we offer the organ, the physicians from whatever organ group that is will determine who is in most need on their list. So if they're on the wait list with a BC organization, then yes, that would include them.
Okay, so here's another one of those very common questions that we get. Is there an age limit to who can register or donate? I know earlier you were saying under the Human Tissue Gift Act that it's 75, anyone who's in hospital, has died or impending death, they get referred to BC Transplant. So is that the limitation, 75, or you know, if I'm 80, can I register? What are your thoughts on that?
We want hospitals to call all impending deaths in. We've done a 79-year-old in the past. The recipient list is always changing, so our criteria is always changing. So what we're accepting will change depending on who's on the wait list. If we have a 75-year-old who's waiting for a kidney, well, we will accept a 75-year-old because of that wait list. So it's always changing, and our criteria is always changing. So there is no age limit, and we would just encourage everybody to call everything in so that we can see if there is any potential matches with anybody on the recipient list.
Another question for maybe for both of you, since you both work with families and who are considering donation for their loved one. Why is it so important for someone to register their decision? You know, if you are talking to all families anyways of potential donors, does someone really need to register?
We find it very helpful for family members to know what their loved ones' wishes are. So registering and most important, talking to your family about your wishes, because at this time it's very tragic. So the family has just lost someone they love very much, and so it can be extremely emotional. And if they don't know what your wishes are, sometimes that's more stress on them to try and make the decision that you would have wanted. Whereas if you've registered your wishes, then they can see. We can physically print out your registration, show them exactly what you wanted. There's even a little box at the bottom where you can leave a little note if you wanted. And that's often very meaningful to families. But it helps them to know that the decision they're making is exactly what you wanted, and it takes the stress and pressure away from them. So registering is really important, and also just letting your family know, have the conversation.
Yeah, and like I've met with families who are very certain, you know, oh, we did talk about this, you know, we saw one of your ads and we had this conversation. And so I know that she would have wanted to do everything she can to help people. And then sometimes, like Kim said, there's a spot where you can make comments on the registry. And so I've actually printed that registry and given it to the family because they can see their loved one's comments, what they would have wanted, the date that they signed the registry. So I think it's very impactful to, you know, have the conversation, but also go online and do it.
Great, thanks to both of you for that one. Here's a question. The question says, what qualifications do transplant coordinators have? I'm going to assume we mean the roles that you guys have as organ donation specialists. And I know, Kim, you're also a surgical recovery specialist. So maybe you guys could share, both of you, your qualifications, your background, and maybe even how you got where you are in this role.
Sure. So I am a nurse. My background is as an operating room nurse. So I worked as an operating room nurse for 12 years before coming to this job. Originally, I started out as a surgical recovery specialist because my specialty was in the operating room. And then over the years, I did a lot of studying and training, and I was able to cross-train over into the role where I can work with the ICUs and the families as well. Most of our staff are either nurses or respiratory therapists. We all have critical care medical background and then get specialized training to do this job as well.
Yeah, so I'm a respiratory therapist, and there's several of us that work at BC Transplant. And as a respiratory therapist, we work primarily in the ICU with patients on ventilators. So we're always part of that end of life process, disconnecting people from ventilators to let them pass away. And so when I was an RT working in the hospital in the ICU, you know, I really found meaning in these organ donors that were able to go on and save lives, and after we took them off the ventilator. So that's why I pursued this role. And then midway through being in this role, I ended up losing vision in my eye, and I ended up needing a cornea transplant. So I went from unable to bike with my daughter, read to her, to now I've had my own transplant and I'm able to read to my daughter at night and go on bike rides.
Thanks both, Bobby. That's really lovely to hear. You know, you have that really personal connection even to the world of donation and transplant. It's really, really amazing. Couple more questions, and I should just note, so we have just 4 minutes left looking at the time. I should note that I prioritized the questions around donation, deceased donation primarily, just and donation generally rather than transplant, because both Kim and Bobby are part of the donation team and they're less involved on the transplant side of things. So sorry if I've missed your question. What I can do is I can try and follow up on some of those other questions we've received that we don't have time for, but are also you know, outside of the scope of Kim and Bobby's knowledge and expertise. So one of the questions that we've got here was, can organ donors and recipients cross ethnicity? And I guess, you know, we could ask that question generally, you know, males to females, females to males, like, is there any limitations in that regard? Maybe whoever wants to answer it.
Sure, I can answer that, that's fine. Yes, they absolutely can cross over. Because we're doing the testing, what I said before, we test the blood, it actually goes to our immunology lab, and the blood is tested at a very a level called an HLA matching that matches the blood to prevent rejection once the recipient receives it. So basically the factors we're looking at don't have anything to do with culture or ethnicity or background. We're looking at, does the blood match? Is it the right blood type? And the antibodies will match, as well as size. So male to female is not an issue. However, a lot of larger males won't fit because females are sometimes smaller, but there is no rule about that. We have lots of male donors that go into female and female into male. It's all about size.
Okay, good to know. I know that was something that really surprised me, or just didn't realize before, was the size piece. When I started at BC Transplant, I thought, wow, that's really interesting. I never thought about that before. And so here's a question about, for those waiting for a kidney transplant, do you have resources to help them find a living donor? If you guys don't mind, I'll just plug in and say we do have some online resources on the BC Transplant website, transplant.bc.ca/living donation. And there's resources there with some potential templates for letters that could be sent out, and certainly through our Transplant First initiative, the kidney care clinics often will have access to these and help provide information and tools for reaching out for donors. So hope that helps for the person who's asking that question. So we have time, I think, just for maybe one more question, and we'll put that one to you, Bobby, and it's a question about children. Can I register my children in the registry?
Yeah, so you can go on and, like, with your PHN number, register your child, and you'll have to sign for them. But once they become 19 years or older, they're going to have to re-register themselves when they become of age.
Okay, thank you. So I think that's, unfortunately, I think we still have questions that we could go to. Sorry we couldn't get to all of them for everyone. I just want to first say thank you to Kim and Bobby for sharing your knowledge and expertise and letting people know about how it works here. And also just to thank you for the work that you do every day. It's really incredible work, and certainly we appreciate the work that you guys do for BC Transplant and for the people here in BC. And thanks to all of you out there joining us. I hope you all learned something new today. And if you have any other questions, if you're following along on Facebook, you can send the questions to us. We try and answer questions that we do receive in Facebook. So please do add those there. And of course, I would be remiss if I did not remind everyone, if you haven't already done so, to please take 2 minutes to register as a donor yourself at take2minutes.ca if you haven't done so already. And a reminder, the session is recorded and will be available on our Facebook page, and we'll aim to add it to our YouTube channel as well in the coming days. Thanks, everybody. Enjoy the rest of your day. Bye.
Thank you.